Hello everyone. So today we'll be discussing OET urgent letter for nurses, or we can say the OET emergency referral letter for nurses that a nurse has to write to a doctor. Whenever we have emergency letter, we have multiple visits sometimes by a patient. And finally, the patient is being referred to a neurologist or a doctor or any other specialist on urgent basis. So sometimes the candidates, they are confused what should be written in the letter, how to select the case notes in an emergency letter. So I'm going to discuss those things today. See, when we write OET referral letter, it generally contains information in chronological order of events. However, if we write emergency letter, it may require a different order. So today I have a referral letter, the case notes that I'll be discussing with you. You can read the case notes on the screen and I'll give you some time to read the case notes. The patient's name is Miss Daisy Clarck. Before reading the case notes, always read the writing task first. So here we'll read the writing task using the information given above. You need to write a referral letter to the doctor who's a neurologist. The name of the doctor, it's Denver Smith. Dr. Denver Smith, the neurologist who will attend the patient in emergency at the hospital. Daisy Clarck is 39 years old as per 28th of April 2021. She has been a patient at a hospital you're working in as a head nurse. Apart from appendicitis, she had been healthy. Then subjective, on 22nd of April, she visited. Subjective means according to the patient what she felt. Frontal headache, mild ulcer, nausea, no vomiting, blurred vision but not aura. No other symptoms, no family history of migraine. Then objective means what you noted when you took the vital signs. Pulse rate is given, blood pressure, normal cervical spine, movement, examination normal. Assessment was probably due to excess tension or personal dilemma. Plan is mentioned, advised to take rest and given analgesics. Then again, 27th of April, she visited with continuous headache that was left-sided and frontal, blurred vision, throbbing headache which was left-sided, vomited 5 times during last 3 hours, complaining of slight paresthesia. Objective, distressed, pulse rate is given, blood pressure you noted, normal peripheral nervous system. Assessment was severe migraine possibility. Then plan was there, it is about the medications. Then, on 28th of April, it's written home visit. Means patient did not visit you, you visited or the home visit was provided to the patient. So, subjective means she fell down at home due to severe left-sided headache, started some 5 hours after reaching home, and injured right arm, bruises on left leg, slurred speech, half unconscious. Then again objective information is given to you, the vital signs. Assessment was probable intracranial pathology, space occupying lesions. Then the patient was urgently referred for assessment in emergency department. So this was all about the case notes given to us. Now we'll begin how to write the letter. The first thing, introduction. So introduction of an emergency letter, it's same as a normal referral letter, but the only difference is you need to emphasize more on urgency of the situation. So we need to focus more on assessment and purpose in the introduction. So here the reader, who's the Dr. Denver, he would need more information about why she is being referred in emergency. So how you'll start? I'm writing to refer Miss Clarck, a 39-year-old woman. This is a tagline, starting line, and then we need to write the chief complaints. We'll write about the signs and symptoms. Then in the third sentence, we'll focus on purpose, that is urgent assessment and management that she is requiring. So how the introduction of this letter would be like this. I'm writing to refer Miss Clarck, a 39-year-old woman who shows signs and symptoms of space occupying lesions and intracranial pathology. She requires urgent assessment and management. So this is how the introduction would be. Now let's move on to the next part of the letter, that is a body paragraph. The first body paragraph of the letter would be, here you need to organize the information very carefully because this is urgent OET letter. The first body paragraph needs to be started with the current condition of the patient. Please keep in mind, when you are referring the patient in urgency or it is an emergency, you need to start with current condition, because here your reader, who is a neurologist, needs information more about the current condition because it's an emergency, and also he needs to know the symptoms of the patient in order to have a better overall understanding. So this is more logical way to write it. So we need to start like this. Today, Miss Clark, like this. Then we need to mention about fell down, injuries, speech and unconsciousness, this thing. So this information we need to cover in this sentence. Here, kindly try to group all those symptoms and vital signs together wherever possible. Please take care, do not use too many informal connectors. Sometimes if we ask the candidates to involve or write connectors, what they do is they write unnecessary connectors. So the flow of the letter should be natural as much as possible. So it would be, she also had slurred speech and sustained bruises on her left leg and injuries to the right arm. And also we need to mention this, her pulse rate, blood pressure, and left leg knee flexion, this also. So you can write, her pulse and blood pressure were high at 100 and 150 by 90 respectively, whereas left leg knee flexion was at 4 by 5. So if we combine all those things, the body paragraph 1 would be, today Miss Clark fell down at home due to severe left-sided headache and was half unconscious. She also had slurred speech and sustained bruises on her left leg and injuries to the right arm. Her pulse and blood pressure were high at 100 and 150/90 respectively, whereas left leg knee flexion was at 4/5. Now, let's move further towards the visits. We need to make the reader an overall progression of patient's condition. So, we need to start from the first visit and we'll move to the subsequent visit. So, her first visit, it took place on 22nd of April. So, we can start by writing the date. Like, we can start on April 22nd, Miss Clark initially presented to our hospital with a 5-hour history of frontal headache accompanied with mild association of nausea and blurred vision. This is what we need to mention. Then we'll focus, next line, we'll focus about the plan and assessment. Here we'll write, due to the possibility of personal dilemma, we'll use the word possibility. And excess tension, paracetamol 500 mg was given and every 4 hours, and rest was advised. Then we'll focus on, here if you want to gain good marks, you should try to also present something variation in condition over the period of time, so that the reader can understand like whether the patient's condition has been improving or it's deteriorating. This time, Miss Clark, she returned 4 days later with worsening symptoms. You can add continuous headache, blurred vision, throbbing headache, these things. So when you are writing about the change in condition and there are more than one event which occurred in the past, you can use a tense form like Miss Clark's condition had worsened over the next 4 days and she vomited 5 times. She appeared distressed and complained of slight paresthesia and blurred vision. And then we need to focus on her vital signs and treatment plan. Very simple. We can use the word, her pulse and blood pressure were high at this and this respectively. As a result, maxillin 10 mg, intramuscular inject and pethidine 100 mg were administered. So, how this paragraph will be? Here, I have combined 3 sentences. Miss Roberts' condition, we'll use the connectors here. Miss Clark's condition had worsened over the next 4 days and she vomited 5 times, as well as this, I use the connector here, as well as this. She appeared distressed and complained of slight paresthesia and blurred vision. Her pulse and blood pressure were high at 103 and 150/90 respectively. Then we'll use the word as a result. Maxilin 10 mg intramuscular inject and pethidine 100 mg were administered. Now, let's move further towards the conclusion. See here, there is no significant medical history, no social factors of the patient. So you can directly go to the concluding paragraph where we reiterate the need of the assessment and management. So you can write it like, your assessment and management of Ms. Clarck would be highly appreciated. Please do not hesitate to contact me. Then, should you require further information about this patient, then yours sincerely, nurse. So this is how you need to attempt this urgent letter or emergency referral letter for nurses. You can see a complete letter on the screen so that you can refer the sample solution, what I have discussed with you. I hope you have liked this emergency letter sample by me, and you can visit my other videos for such kind of sample letters and relevant answers to your doubts in the writing subtest. Till then, stay tuned, focus on your writing practice and other modules. Good luck.